When you have a ventilator or tracheostomy, one of the most important indicators of your lung health is your sputum. Knowing your sputum's normal appearance, including its texture and color, is very important. If you know how your sputum normally looks, and if its appearance changes, you can quickly identify there is a problem and seek medical attention. Sputum is mucus from your lungs. It can be a variety of colors, from black to white and anything in between. Sputum can have no smell, or it can have a very strong odor, which ranges from smelling very sweet, like grapes, to very foul, like rotten food. Texture is also important. Normal sputum should be watery. If sputum is thick or sticky, this usually indicates an abnormality. Sputum can range from person to person. Therefore, it is very important to know what your sputum normally looks like, its texture, and even its smell. Although this may sound gross, knowing your sputum may help identify a health issue before it becomes a major medical crisis. Normal sputum should be clear or a pale white. It should be watery and have either no smell or a faint smell. There are conditions which may cause excessive clear or white sputum production. If you notice an increase in clear or white sputum, you may have one of the following conditions. You may have fluid in your lungs, which can produce clear, white, or pink frothy sputum. You may have a viral respiratory infection, which may produce clear to white colored sputum. You may have chronic bronchitis or COPD, which can produce clear to gray colored sputum, or asthma, which can produce white to a thick yellow sputum. Yellow sputum is often due to the presence of white blood cells, particularly neutrophils and eosinophils. These cells are often present in chronic inflammation, allergies, and infectious processes. The most common causes of yellow sputum are acute pneumonia, which produces white to yellow sputum, acute bronchitis, which produces white to yellow sputum, asthma, which produces white to a thick yellow sputum, and allergies, which produces white to a yellow sputum. Green-colored sputum is an indication of a long-standing, possibly chronic infection. The green color results from the breakdown of neutrophils. It may also be seen in long-standing, non-infectious inflammatory conditions. The most common causes of green sputum are pneumonia, which produces white, yellow, or green sputum, chronic bronchitis, which produces clear or gray to green sputum, lung abscess, which produces green sputum, and bronchiectasis and cystic fibrosis, which produces green sputum. Red sputum is usually an indication of whole blood. It may completely discolor the sputum or appear as streaks or spots. Pink sputum is also a sign of bleeding, but it usually occurs in smaller quantities. Rust-colored sputum is also due to bleeding, but the clotting process may have started. The red blood cells may have broken down to produce a rust color. The most common conditions to cause red, pink, or rust-colored sputum are pneumococcal pneumonia, which produces a rusty red sputum, lung cancer, which starts out pink or red and progresses to brown or black, tuberculosis, which starts out with bright red streaks and progresses to completely red sputum, and blood clots in the lungs, which produce a bright red sputum. Brown or black colored sputum is an indication of old blood. The color may be due to the breakdown of red blood cells. Certain organic and non-organic dusts may also cause a brown or black discoloration of the sputum. Common causes of brown or black colored sputum include chronic bronchitis, which produces green, yellow, or brown colored sputum; chronic pneumonia, which produces white, yellow, or green to brown colored sputum; lung cancer, which produces a red to brown to black colored sputum; tuberculosis, which can cause a red to brown or black colored sputum; and coal worker's lung, which produces a brown to black colored sputum. If your sputum appears to be blue, you most likely have a bacteria called Pseudomonas. Pseudomonas bacteria have pigments which cause the sputum to turn bright colors. The three main colors are green, yellow, and blue. While green and yellow sputum can be caused by other factors, if your sputum is blue, it is very likely you have a Pseudomonas infection. Pseudomonas is a very hard to treat bacteria. If it is caught early, it is easier to treat than once the infection has had time to spread. At the first sign of seeing blue sputum, immediately seek medical attention. In general, sputum does not have a smell or has only a faint aroma. If you notice your sputum has a strong smell, this usually indicates a health problem. Sputum, which has a foul smell, often indicates there's a gram-negative bacteria present. If your sputum has a sweet aroma and may smell like grapes, this is most likely due to the bacteria called Pseudomonas. Please also note, Pseudomonas can also smell like corn tortillas. My Pseudomonas infection smells like corn tortillas, and when it acts up, I often crave salsa. It took me a while to figure this out, but if I'm suddenly hungry for salsa, I know it is time to go to the doctor to get antibiotics. In 2018, I had a procedure done on my pancreas. After being discharged home from the hospital, I noticed my sputum had abruptly changed. It was thick, yellow, and smelled very sweet. I did not feel well. I went to the emergency department. They admitted me to the hospital and started me on IV antibiotics. 2 days later, my cultures came back positive for Pseudomonas. I was told this bacteria was just part of the normal flora of my respiratory tract. I protested and said I never had Pseudomonas grow on a culture before. Moreover, my sputum was not normal. My words fell on deaf ears. I was released home without antibiotics. 2 weeks later, I abruptly became severely sick. I spiked a high fever and felt as though I was going to die. I went back to the emergency department. My chest x-ray indicated I had a large hole in my right lung. My sputum culture came back positive for Pseudomonas, the same bacteria I had 2 weeks prior. Now, the bacteria had thrown a party in my lungs and was making me extremely ill. I was admitted to the intensive care unit. My journey with Pseudomonas has been a long one. The bacteria became resistant to all drugs, and I had to be given an experimental drug called Zerbaxa. I had an anaphylactic reaction to the medicine, and the story of my Pseudomonas infection goes on and on. Because the bacteria was not properly treated with a course of antibiotics when I first became ill with Pseudomonas, the bacteria has taken up residence in my respiratory tract. I have never been able to get rid of it. The bacteria flares up every 3 to 6 months, which often results in me having to go to the hospital for 5 to 7 days, get a PICC line, and be sent home on IV antibiotics. I have learned a lot from my experience with Pseudomonas, the most important of which is if you notice your sputum has changed, seek medical attention. If you feel as though you received not the proper medical care you deserve for your condition, go to another medical facility. Thank you. so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.